Gracias, doctor Hugo López-Gatell. Da para mucha reflexión y
Thank you very much, Dr. Gatell. This is great food for thought with regard to our network. In order to continue with our program, our next lecture will deal on regulatory certainty. In Mexico, the National Commission for the Protection Against Sanitary Risks has become, no doubt, the regional leader and an important actor, one that is key for the supply of the new technological developments and also the practice of clinical research. For this reason, it is a great pleasure to introduce Dr. Alejandro Svarch Pérez, who is a physician, a graduate of the National Autonomous University. He was part of the High Academic Demand Program at the School of Medicine, and he was member of the support program for the promotion of research in students. He's a specialized physician in internal medicine by the National University of Mexico, clinical training in the high specialty hospital of Pemex, at the National Institute of Medical Sciences and Nutrition, Salvador Subirán, high specialty hospital in Yucatan, and the Medical University Center Abasha in Jerusalem. He's certified as specialized in internal medicine by the National Normative Board of the Medical Specialty Board, and he also has studies for global health and diplomacy by the State University of New York. As of February 16, 2021, he was appointed as the head of the National Commission for the Protection Against Health Risks, with its acronym COFEPRIS in Mexico. Dr. Svarch, you have the floor. Good morning, ladies and gentlemen. With the permission of Assistant Secretary Dr. Hugo López-Gatell and my mentor, Dr. Lascano, Director of our dear National Institute of Public Health. And with your permission, I will begin with my presentation, and I agree with Dr. Lascano about the step here. For COFEPRIS, it's a real honor to be today with all of you in this very important international clinical research networks forum for clinical research. We will speak about regulatory certainty for the strategies leading to preparedness and response in the public sector in this time period, 22 to 2030, according to the experiences gained by our agency with regards to the management of the 2019 pandemic. In order to duly understand how important this topic is, we should begin first by defining this term of regulatory certainty. For the health sector of the Mexican government, regulatory certainty is the compliance with all of the normative framework that allows us to be protected against any health risks. It means that our requirements, processes, and times for evaluation should be clear. It also means having interaction bodies for those regulators and regulated and the ones participating in this forum in order to have fruitful spaces, corruption-free for the exchange of information. And it also entails the commitment that changes to be implemented should have an innovative and long-term perspective to guarantee efficacious access to new medical treatments, from innovative treatments up to biosimilars and generics, considering the life cycle of the pharmaceutical product. This strategy must be understood within the context of our country. As was demonstrated throughout the pandemic, the COVID-19 pandemic, Mexico had all the capabilities to be a country with access to safe medical treatments that are efficacious and of the right quality. Our country efficiently applied millions of vaccines for COVID-19. So this shows that we do have sound institutions and a productive health sector that follows international standards. Notwithstanding this, we did identify regulatory barriers without technical scientific basis from the clinical phase up to the granting of the health permission that allows the access to new medical treatments. It's also important to say that some of these cases are responding to individual private interests and not the health right that is spelled out in our Constitution. The consequences identified in this partial regulatory ecosystem that is designed by just a few people are the following. First, the increase in the price of medications due to the lack of competition in the market. Second, the absence of an equitable access to efficacious, safe, and quality drugs for the population. And third, the lack of clinical innovation because of the demands of favorable and excessive rules to promote innovation in our country. As the President of Mexico and the Health Minister have stated in this national development plan, our strategy tries to avoid corruption, to attain administrative simplification without deregulation, and to guarantee the supply of drugs in the country. The latter under the principle that the market couldn't replace the state. This plan includes several commitments of Mexico in international instruments as treaties, memberships as the International Conference of Harmonization of Technical Requirements for the registration of pharmaceutical products for human use, ICH, as well as good regulatory practices of the World Health Organization. Our strategy includes 7 commitments that will be implemented in an 8-year horizon time, including high-impact measures to have a fair, expedite, and transparent regulatory environment. The first one is by the implementation of a committee of good regulatory practice with the purpose that all changes in the regulatory framework be coherent and viable, with management change in order to guarantee the implementation and adaptation of the new framework. This first commitment will be ready in the next weeks as a clear working agenda that will be publicly released. A second commitment entails the compliance of the regulatory development plan agreed upon with ICH so that Mexico would be accepted as this international consortium. As you might remember, as of November 17th of last year, Mexico is an official member of ICH, being the first Spanish-speaking agency being a member of this consortium, including 3 phases. First, the adoption of the E6 rules of ICH through a Mexican norm for good clinical practices that will bear an impact of the national scientific development. This process that began last year will be concluded next December of this year. The adoption of 3 guidelines in a time period of less than 5 years. Let me stress that even though ICH demands that these adoption phases Currently, the E2A corresponding to the management of clinical safety and E2Bs that have to do with elements of data for the transmission of reports on safety on individual cases are already a part of the national regulatory ecosystem and are already implemented. The implementation of the more than 100 guidelines issued by ICH will be done before 2030. This achievement will allow us that products developed and manufactured in Mexico can have international validity. And also, this will contribute to the fact that COFEPRIS's decisions can be accepted and adopted by other countries by meeting the supply needs for emerging diseases or neglected diseases. In order to optimize all procedures in our agency, we've developed an ambitious digitalization program with two pathways. First, self-managed procedures for digital use as an automatic response for administrative decisions that do not affect or commit the stability of the medication or the drug. Second, virtual assessment of extensions for sanitary or health approvals in order to optimize the times for the final ruling. Together with this plan, we are also working on the launching of a new platform this year for the modification and change of clinical protocols. It's important to say here that also at COFEPRIS, we've been able to reduce in more from 190 to 90 days as an average for the approval of new clinical trials, and we will reach 60 days by 2023. We also contemplate the integration of more than 70 databases that we have in our agency in one single data set reservoir to continue providing digital services of our health agency. If we learned something from the pandemic of 2019, it was to recognize regulatory decisions of other countries and not only those of great Western powers, but also learning from countries that have similar regulatory structures as us, Argentina, Brazil, or Chile. It's also very important, and it is a strategic work we are carrying out with the Undersecretariat of Health, so that proactively we can register products that are needed in the health sector, irregardless if they were delivered with an application or not. This is proactive registration of strategic supplies in emergency contexts. For this reason, COFEPRIS is carrying out institutional efforts to adopt resolutions from other agencies that have high surveillance level recognized by WHO for the management of foreign products, so that our institution can channel the workforce in taking care of the national productive capabilities, both in innovative drugs as well as generics and biosimilars. As a fifth commitment, we have the elimination of regulatory barriers with regards bioequivalence and biocomparability tests, so that we can give access to medical treatments at a lower cost for the benefit of the population of our country and of the region. And we will also raise the requests in parameters to determine that a generic or a biosimilar has the same efficacy than the reference drugs, ending this way the vicious circle that only benefited pharmaceutical businesses without really benefiting health sectors and what it meant to be done. The next commitment includes the elimination of unnecessary obstacles for the registration of biotechnological foreign manufactured products. There is a lot of oncological products in this area. The national regulation demands the certification of COFEPRIS of foreign plants manufacturing biotechnologics without considering if these plants have already been inspected by other agencies. So currently we are thinking in changing Mexican norms in this regard in order to recognize the good manufacturing practice certificates, avoiding duplicity that restricts the access to fundamental treatments for the benefit of everyone. And finally, for the supply of raw materials that are better known as active pharmaceutical actives or ingredients, we will do the necessary adjustments in the decision-making of our health agency in order to allow their entry with new pharmaceutical entities, even though there are APIs that should be assessed with the high scientific and technical norms. There are low-risk raw materials that can guarantee their efficacy and safety through other instruments like analytical certification of origin, thus facilitating the entry of fundamental drugs for the national production. And also, this measure can break geopolitical inertias that try to have control of manufacturing of drugs in central countries, thus affecting health global equity. As I mentioned at the beginning, our certainty regulatory strategy for preparedness of our sector is a long-term vision. Without going into details, we show here all the timeline of activities we are committing to in order to have supply, administrative simplification, and eradication of corruption. And also, this is a proposal aligned to the learning needs in health regulatory needs left by the COVID-19 pandemic. We are convinced that by using these strategies, we will be successful in transforming our country, going from being a manufacturing power to become the right space for medical innovation. With the implementation of these 7 commitments that are part of the strategy that we are now presenting, COFEPRIS is helping in the right guidance of the state for public health policies in Mexico to attain the right balance between access to drugs, safe, efficacious, and quality drugs, and the development of a pharmaceutical industry that is competitive, honest, and responsible. Thank you very much.